Nick and Colin, fantastic to have you with us today. You're both experts on COVID, which we can all agree we want behind us. And yet, people are more divided than I've ever seen in this lifetime about this virus. On the one hand, there are people who say we want our policymakers, the experts, our president, our governors to just tell us what to do. And on the other, are people saying we'll take your guidance, but we want to be free to choose how we deal with this. Today is going to be a debate between the two of you. And on the one hand, we have Colin Furness. Colin, you're an infection control epidemiologist at the University of Toronto. Nick Hudson, you founded the Pandemic Analysis Group. And you believe, Nick, that individual rights trump the collective. Colin, you're out in favor of the collective trumping and taking precedence over the individual. My hope today is that the CEOs and leaders listening to this can crystallize their view, can form a position on this matter, because you leaders are the ones influencing and even creating, in large part, our future. We want to elevate the bar from listen to the science, which any rube can say, but doesn't mean anything because there's science on both sides, as we'll see. And we want to elevate it to a point where we can have some meaningful change. With that, Nick, start us off. Let's dive in from the deep end. Thank you both for joining me today. And Nick, why don't you start out by sharing your thoughts on how we should be dealing with COVID?
Well, definitely not this way. For me, the most shocking episode of my life has been the last 6-7 months, probably even longer now. I keep on saying that number, but it's as time drags, you kind of lose track. I and a group of friends started looking at this in March and started seeing an emerging panic, an emerging hysteria that bore no relationship to the actual reality that was faced as far as we were seeing it. And we saw the emerging lockdowns, and living in a middle-income developing country like South Africa, we read the writing on the wall. We saw that they embedded the potential for enormous harm, far exceeding what the virus might have to offer. And so we began injecting into the local narrative the idea that lockdowns were not without consequence. And that was the beginning of Panda. Since then, we've absorbed scientists from any number of disciplines: immunology, epidemiology, vaccination specialists, doctors, economists, all sorts. We tried to build a multidisciplinary group that would take the analysis into what we saw as the domain of the good science. And our perspective on this from the beginning has been that the lockdown movement basically represented an abandonment of pre-COVID science. If you read the epidemiological texts before COVID, they were very consistent. They all spoke out against lockdowns, which were then called quarantining of the healthy, justified largely on the basis of their collateral damage. But a more subtle reading also takes you to works of epidemiology that stress the adverse nature of general coercive measures in the face of an age-graduated epidemic like COVID. When you have distinctly, sharply age-graduated mortality, anything that you do from a general coercive perspective is going to shift the burden from the non-vulnerable to the vulnerable, and is expected in terms of conventional, fairly basic epidemiology to lead to a worsening of mortality from coronavirus. And that is indeed what our research has shown we see. Lockdowns have not been associated with a reduction in COVID mortality, far from it. The other aspect that has really been stunning for us is the extent to which any narrative not provided by the World Health Organization or any one of a number of governments has been subjected to the most ruthless censorship. The environment has not supported debate or engagement on any of these subjects. And so what we see emerging is these strong centralist perspectives that are hugely coercive, very destructive, and it doesn't even make sense to talk about a trade-off or a net balance being struck, because they are destructive both in terms of the coronavirus epidemic and in terms of the collateral damage. And you would think that people who were saying things like this and saying that they were concerned about the effect that such measures would have on inequality, on, in terms of their regressive, profoundly regressive nature, would have at least a seat at the table. But from the word go, we have been censored left, right, and center. And so I approached the whole discussion with a great deal of passion, and I hope that I managed to contain myself in the debate. Our very strong sense from the get-go has been that this has been a disaster, and largely because centralized decisions were taken, alternative voices were hindered from even getting out into minor media, let alone mainstream media. And the result has been the most catastrophic human rights abuse of all time, the worst public health policy of all time. Our views are scathing with respect to lockdown and with respect to the other coercive measures that have been undertaken.
Mm-hmm. And Colin, I'm guessing you could respond that we've done things as well, quite poorly, but just with a very different lens. How do you think we've managed so far in dealing with COVID? How do you think we should be dealing with COVID?
I think Nick and I can actually agree on quite a bit. We can agree that governments have done a terrible job. We can agree that the World Health Organization has actually contributed negatively. I absolutely agree. And I think we can also agree that lockdowns, now I'm not sure what we mean by that word. I don't know what anyone means by that word, but lockdowns in an emotional sense or in the broadest sense are very problematic. There's no question. So I think there's a lot we can agree on. But I want to be clear that, our resolution today is that individual liberty versus collective action. Lockdown is one possible tool, but that does not define collective action. And so I'd really like to broaden out that discussion. In public health peacetime, I'm all about individual liberty. When we're talking about that you should drink less or eat more fiber or whatever we're talking about in terms of population health, I'm a strong proponent of education. I'm a strong proponent of establishing positive social norms, leading by example, doing research. There's a lot I could say that really favors individual liberty. But that's not the case in an emergency. In an emergency, and there's a lot of precedent around the world, it's possible to bring in a separate set of rules to say, during an emergency, we need to do things differently. The classic one is the Blitz in London during World War II. People were forced to sit in the dark at night. Now, if that is an incursion on individual liberty, I don't know what is, right? No talking, no reading, nothing, sit in the dark, be quiet. Why? Because when you flick your lights on, you're providing a target for bombers. So everyone has to. It's not about individual liberty. It's not about please turn off your lights. It's like, let's all band together. No, there are no lights. There are no lights. There can't be. Otherwise, we all die. So there's no room for individual liberty. There's no room for being an iconoclast. You move together. More recently, I was a New Yorker during 9/11. I lived through that. I remember it very, very well. And within days, the Patriot Act was drafted, and within a few more days after that, it was passed. Americans gave up almost all their cherished privacy in one fell swoop, and they did it enthusiastically for a law that actually had a sunset provision, right? So a separate set of rules. They gave up what they value the most, which is privacy from government. They did it because they were terrified, because they were facing a foe. Both of these examples are wartime, and I like to see COVID as wartime. It's a wartime situation. We're under attack. And whether COVID is killing people or merely causing catastrophic brain damage is kind of neither here nor there. It is a very, very nasty disease. I know a bit about communicable disease, and I can tell you right now that we're only starting to discover just how bad COVID is. We don't fully understand it, but every time we make a discovery, the situation gets worse. So when I think about the first wave, when I think about what happened in March, I think about Northern Italy. I think about New York City. I think about refrigerator trucks with corpses piled up. That happened. That actually happened. And it happened because those two populations weren't yet ready with any kind of collective action. What happened was healthcare systems became overwhelmed. And whereas COVID has a small, low case fatality rate, I absolutely acknowledge that. It does that because we have working healthcare systems. When we do nothing, when we allow individual liberty to reign, in an emergency situation, healthcare becomes overwhelmed. That's what happened in those two places. They weren't aberrations. That's what happens if you don't actually take collective action. No one wants to see people dying avoidably because there wasn't a hospital bed available for them. So whereas we look at case fatality since then, it does look like COVID's not a big deal, but that's because of collective action. The collective action that was taken during the first wave, and those lockdowns were awful, absolutely, that allowed us to discover very important things, like we need to give people blood thinners. That took a few months to figure out. Why? Because we had no idea that COVID attacks the lining of your blood vessels and causes blood clots, catastrophic damage throughout the body, including the brain. That took a few months to figure out. And we slowed down. We stopped healthcare systems from being overwhelmed in a lot of places. We slowed down. Now, the problem with that is we died a success. We did such a good job of keeping COVID in the box that it actually really emboldened a lot of people to say, hey, COVID's no big deal. COVID is just the flu. I don't accept that, because I look at Northern Italy, I look at New York City. That's the face of COVID. And everything, every city, every region on the planet that did not suffer that way because of collective action. Now, I want to also be clear that I agree with Nick. Governments have been very incompetent, incredibly incompetent. And that's because they've been trying to accommodate individual liberty, and they've done it by rejecting expertise. Everyone seems to be an epidemiologist today. Nick made reference to epidemiology texts that talked about lockdowns being a bad thing. I know of no such authoritative texts. We know that quarantine, as a very specific tool in fighting infections, works incredibly well. And it's worked well for about half a millennium since the concept was actually invented. As for whatever else Nick is referring to, I don't think they're epidemiological texts. I don't know what they are. When we throw away expertise, when everyone gets to be an epidemiologist, we have a proliferation of opinions. That's a kind of individual liberty that's a problem as well. I think we need to return to the domain of expertise. And finally, I guess I want to say that, COVID spreads asymptomatically. This is something that governments, including here in Ontario where I live, have not recognized, have not acknowledged, have not responded to. This is part of the government incompetence. We were never prepared for an asymptomatic pandemic. We were never prepared for something that was going to kill this way. I remember on February 10th reading a case report of a man who went to Singapore and France and then the UK. He never felt sick a day in his life. He visited friends. He left a trail of destruction, of illness, of death among his friends. I don't think that guy's ever going to forgive himself, right? It wasn't about making smart choices. He had no idea. He had no agency because COVID outsmarted us all. COVID denies us that agency. When we have individual liberty without that kind of awareness, we can't make smart decisions. And finally, I would point to countries like Sweden, which are sort of indicated as, hey, look at Sweden. Sweden is all about individual liberty, and they've done really well. Well, actually, I think Sweden's being terribly misunderstood. If you look at the taxation rate in Sweden, they don't have homelessness because they collect taxes to make sure everyone's got a home. 32% payroll tax, 25% federal tax, 25% sales tax. They're the most socialist country on the planet. They favor the collective every which way. And because of that, they made a decision that they felt that they were so oriented to the collective that they could let individual liberty go and take command there. And they were wrong. So even in the place, one country where we would expect individual liberty to work, it still didn't work. Why? Because the mortality is 10 times that of their neighbors. Because they've actually, there's a great Time magazine article a few weeks ago, they've been misleading with their numbers. And yes, their economy has sustained horrible damage. So individual liberty, even in the best situation, doesn't work.
Nick, I have some questions for both of you, but before I indulge, would you like to respond?
Yeah, I think it might be worthwhile just responding on this pre-existing literature in the epidemiology, and I'll do so by simply quoting one sentence from have you heard of Mark Lipsitch, the epidemiologist, his 2008 paper? Epidemic theory dictates that a reduction in the force of infection by a pathogen is associated with an increase in the average age at which individuals are exposed. For those pathogens that cause more severe disease among hosts of an older age, interventions that limit transmission can paradoxically increase the burden of disease in a population. It's there, and it's not the only reference. You can read Gomez, Pegden, Lois, Jeperidje. There are many, many texts pointing out that general coercive practices in the face of age-graduated mortality will worsen the outcome. And that is what we see. So I mean, this is to my point, that the moment you start trying to decide which experts you're listening to, you're hindering knowledge growth. Complexity does not abet authority. You have to have diversity of opinion, otherwise new knowledge cannot be formed in the face of complex problems. And so this tendency, which we've heard many, many times, listen to the science, listen to the experts, you're not the experts, because what they really mean is you're not the expert who's saying the thing that we like to hear. And so we have a collection of scientists who, by probably a third of them, or maybe even more, participate in our organization covertly. That's how bad and how censorious it is. So, I don't really go along with this idea that there's some people who are uniquely ordained to be the experts in any given situation, especially in a situation as complex as this one. And if there's a lesson to be learned in the face of this, it's that, the solutions that can be solved at an individual level simply do not scale when you write them up to nation size. All of the examples you've given here, the example of Sweden. Well, I mean, Sweden's lined up for, broadly speaking, 0 excess mortality this year, So the strategy evaluated by The Guardian in, when was it, March, April, was not the strategy they were pursuing. The shrieking and hollering at what they were doing and how horrible the outcomes were going to be. It doesn't look at all like that right now. And, so I mean, the overriding comment I would have about all of this is there are many factors that drive the differences between epidemics in countries. And the ones that show the least relevance when you look at the intercountry data are the NPIs. Lockdowns just show no discernible benefit. There's nothing. You can't, if you look for the statistical signals in the derivatives of the death curves, they are not there, nowhere near the levels that those original models expected to see them. If you look at the correlation between lockdown stringency on the Oxford stringency scale and mortality rates, there's a 0 correlation. In fact, there's a slightly positive correlation. The stronger the lockdown, the worse the mortality. So, all of these holy cows of 2020, which were not the holy cows of any time prior to 2020, are being slaughtered very rapidly. And it's the very experts that you would have me listen to and that have been the problem. So I'm not sure that going along with coercive, all-encompassing general strategies has helped. Well, I'm very sure it hasn't. And I'm not sure that if it ever was really well advised. The situations when those general coercive measures that sacrifice liberty to the state are, I think, few and far between. And there's a reason that we set our societies up with many safeguards to prevent that from happening. Certainly in my country, what's happened is that the government has abused the license given to them by the state of disaster with dreadful consequences. There's been widespread corruption. The whole middle class has been gutted and destroyed. We have amongst the worst age-based mortality rates for coronavirus in the world, probably the worst. And so the whole policy from beginning to end has been a disaster. If our laws had been better provided for the safeguarding of individual liberties, none of that would have happened.
So Colin, before you dive in, I have to confess, I stumbled upon you through a video I saw where you were telling a pretty entertaining story about how the Premier of Ontario was shouting into the television that we need more testing. And you said, I was sitting there shouting right back at him. And you went on to point out how the Chief Medical Officer of Health also had a dated policy approach, which you took issue with. And so when you see these experts who are divided and can't unite over policy, does that seem to lend itself to more decentralized planning and leaving more of the choice in the individual's hands?
I think we need to disambiguate incompetence and expertise, politicians and scientists. In Ontario, the situation is quite grim. And as I say, I agree with Nick about a lot of things. Lockdowns are a very bad problem. I think they worked briefly very well in March to buy us some time and a great cost. I will absolutely acknowledge. But in Ontario, our premier has rejected expertise. In fact, it's now been revealed by the Auditor General. There isn't a single person at the command table who has actually any grounding in any of this at all. So who are they listening to? It's not clear. They're not saying. Our Chief Medical Officer of Health, I think, is extremely problematic because he won't do anything at all. And it's not about individual liberty. It's about inaction. He's not championing either side. And I think that's actually a really huge problem. Our premier wanted lots of testing, but didn't actually have a testing strategy. And again, collective action and lockdowns are not the same thing. Mask policies, and I know I've seen Nick speaking on a prior occasion. He doesn't believe that. My understanding is he doesn't believe that masks are effective. There's clear evidence that they are. Moreover, some of the evidence he's talking about, I mean, a 12-year-old paper didn't actually anticipate asymptomatic transmission. That changes everything. It changes absolutely everything, no question. So I think, and finally, I guess I would say the science is changing. So I don't think we should be sweeping experts into the dustbin quite so easily. The science changes. One thing I don't have all the answers, but I know what questions to ask. I know research design, and I understand disease transmission, and I understand discovery. All those things matter. They actually matter a lot. And when they're divorced from decision making, and that's been the problem in Ontario, there's been zero expertise involved and a heavy-handed approach. It's the worst of both worlds. I think Nick and I could both agree that the Ontario has been a complete mess. I think mask wearing and very targeted, what I call canary in the coal mine or sentinel testing to actually identify people who are sick based on risk is what we need to do. I've been arguing we don't need lockdowns. We need smarter collective action that don't cause the kind of damage that Nick is talking about. I think it's dreadful. I agree with him wholeheartedly.
On the topic of individual liberty, Colin, you mentioned that Sweden is actually a case that would suggest the collective should prevail. And we kind of heard that coming through the news wave. So I've got a few headlines here. CBS, Sweden becomes an example of how not to handle COVID. That was back in July. New York Times, Sweden's a cautionary tale. The Guardian, they're leading us to catastrophe. But they haven't, it seems, actually tamped down on individual rights. Nothing's been shut down. The restaurants are open, bars are open, schools are open. And it seems like they're doing better than some of their neighbors. On the one hand, it sounds like Spain's had 25 times the number of fatalities per capita, France 10 times, UK 7 times. You mentioned that they're doing worse than their neighbors.
Well,
Can
okay.
we get into how Sweden's doing and why?
Absolutely. Yeah, you got to compare apples to apples. So compare Sweden to Finland and Norway. Why? They're all socialist countries with the same climate, very similar population, similar cultural. Even things like the fact that Swedes, Finns, and Norwegians tend to live alone. They don't live in multi-generational households. For example, they take care of homelessness. They have very little poverty. They have very high taxes. They've all got that in common. So let's compare those. Spain is not a comparator. Compare Spain and France, maybe Spain, France, and the UK, but not you can't put Sweden in that particular group. Sweden's case fatality rate is about 10 times that of its neighbors. And although everyone's case fatality has gone down, and I think Nick pointed this out, Sweden is on track to see very little excess mortality. Okay, so is Canada. We're on track to see very, very little excess mortality. That doesn't mean we don't have a very big problem, particularly because excess mortality can't be calculated yet, right? You need to wait. You can't do that just yet. Also, depending on how deaths are classified and how all that works, it can actually be a very, very poor indicator. We like to use it, but it's not necessarily a reliable indicator. As for individual liberties, my brother-in-law who lives in Sweden tells me that actually, guess what? They're introducing all kinds of restrictive measures. I don't have a clear list in front of me right now, but they are closing restaurants, they are closing schools, they're doing those sorts of things now because they have to. They're doing as little as possible. I don't want to over dramatize this, but my point about Sweden is they felt that they could allow individual liberty in decision making because everything is so aligned to the collective already, and they do prize individuality. And once they've taxed 90% of your income, the 10% that's left, yes, they do prize individual liberty.
So I think it's a bit of a misnomer to call these countries socialist. I mean, the socialist countries in my mind are Venezuela, Cuba, and North Korea. These are mono-ethnic countries in the Nordic region with amongst the freest commercial sectors in the world. The inhibitions, if you want to open a company in Denmark, you can do it in half an hour. This is not a socialist country. This is not
different definition then. Different definition.
This is not a country where the state owns the resources of production, which is the standard definition of socialism. So I think we can, disagree on whether there's socialism happening there or whether that's got anything to do with these outcomes. But you talk about comparing apples with apples. The salient difference between Sweden and Finland, for example, is Stockholm. And if you take a look at the mortality outside of Stockholm, look at the border regions between Sweden and its neighbors, and there's no mortality difference between those border regions. The difference is Stockholm, which has a very different pattern and whole social structure is different. It's not those single person dwellings that you're talking about and so on. And it's for that reason that we at Panda took the view right at the beginning that we were not going to cherry pick, that we were not going to do pairwise comparisons, the secret sauce of pairwise comparisons, as we called it. We would put all the information into one giant study and try and tease out the drivers of mortality. And as I've said, the NPIs and individual responses are the ones that show up with no correlation. The big drivers are simply things that you'd expect, like age, comorbidity prevalence, obesity prevalence is very important, and independently of comorbidities. And I just think there's an overwhelming tendency to place the emphasis in the responses of governments, as those articles that Josh was citing were saying. You know, what is it, the cautionary tale, you know, and it showed us that those actions are not the ones that are very causal. The things that are causal are not under the control of any government. So I'm very skeptical about claims that this country did better than its neighbor. You know, for every pair like that, I can give you a Peru and a Brazil, where the harder lockdown in Peru resulted in a much worse outcome. And I know you've conceded the case about lockdowns, but I would like to generalize that to NPIs. The mask mandate as well. I haven't said that, you misquoted me, but when you heard me saying that masks don't work, I said mask mandates don't work. There's no signal in the data. And once again, the basic epidemiology advises against general mask mandates in the face of an age-graduated mortality disease. You want to protect the vulnerable and let the infection spread amongst the non-vulnerable as much as possible. And masks do exactly the opposite. They inhibit the transmission amongst the non-vulnerable, which increases the disease burden on the vulnerable. So yet another example for me of how, faced with a complex problem, people reach for the intuitive answer. They think they're the experts and they've got the solution. And if you just listen to me, we're going to do this. But they're very good arguments as to why that doesn't work. And again, no evidence in the data. You're reaching for these little studies with 179 people or 2 hairdressers or whatever. But when you look at any data of any scale, there's no evidence. It just doesn't work. And again, the strong politics of the situation. My favorite whipping post, the World Health Organization, against masks, and funny enough, the same day that Maria Kirkova denied that asymptomatic transmission was a major driver. They silenced her, you know, next day walked it back on the basis of a model, not based on any evidence, and then came out with their 180-degree reversal on mask mandates. It's obviously political, and you've got to be suspect of anybody who goes this way.
So asymptomatics come back again, and I think we're gonna have to wrestle that a little bit. Let's go back to your definition of socialism. We can pick a different word, but the countries you named are repressive, brutal regimes. I live in Canada, which we call ourselves a socialist country. Why? Because we orient to the collective. We pay high taxes and we ask our government to do a lot for us. We orient more to the collective than to individual liberty. That's my definition of socialism. We can pick a different word. I don't want to argue about the semantics, but I see in Scandinavia those same kinds of patterns, an orientation of the collective. We can just call it that, and instead of socialism. In terms of pairwise comparisons, I think pairwise comparisons are where you learn quite a bit. It's easy to construct a regression model, it sounds like you have, that comes up with zero correlation. That's easy. Anyone can do that. Put in enough stuff, create enough noise, and you don't get a significant effect. That's actually not helpful. You're drawing a false conclusion. In other words, an absence of evidence is not evidence of absence.
That's not good epistemology. No matter how many control variables you add into analysis, if the variable's not correlated, the control variables are not going to make it less correlated. We showed that on a univariate basis and on a multivariate basis. It's never going to come out. If there's no correlation, there's no correlation. Of course, it doesn't work in the other direction. Causality is not, cannot be concluded from a presence of correlation. But when there's a lack of correlation, you can conclude a lack of causality.
But we know the numbers are very clear that Sweden's case fatality rate is 10 times that of its near neighbors, and your regression model managed to make.
I'm referring to case fatality rates and not infection fatality rates and not population fatality rates. I mean, that's for example balked by the difference in testing strategy. You keep on referring to case fatality rates. If you look at it on a population fatality rate, it's not 10 times different.
It's different. I'd have to look. I'd have to go back. I'd have to go back.
Again, it's different in Stockholm. very different city. With
Okay, so
different...
let's talk about that. COVID, first and foremost, and most easily in urban environments. That's what it does. That's why it hits Stockholm. The rest of Sweden is very rural. In the United States, we've seen it go through super spreading of Dakota in the summer, where a lot of people came from small places, exchanged a lot of COVID and took it back to those small places. And now it's spreading quite readily in rural areas. Sweden hasn't had that, and they're fortunate, and I hope it doesn't happen. But let's not pretend that Stockholm is some kind of weird thing. No. COVID is behaving very predictably. It's behaving very predictably in Canada too. In the urban areas where you have poverty, where you have multi-generational living, where you've got immigration, where you've got racialized minorities doing essential work that is low status, low pay, high risk, low training. This is where COVID goes. It's really predictable. And my point is we can actually use that understanding. And I don't know what your models are showing, and I don't know what's in them, but I see the evidence here locally in Ontario, and it's very clear to me what needs to be done. And it's not broad lockdowns, it's targeted interventions. I think we should be going in the neighborhood highest hit in Ontario. We should be going door to door, and we should be offering to pay people to get a test in their own language. And if they end up testing positive, let's put them in a hotel, buy groceries for the family, pay them lost wages. That's the way to make COVID go away in Ontario. And that takes a collective will. I'm not saying ever to compel. You can't compel. I don't think you should ever compel anyone to be tested, but I think you should induce it. So again, it's not about stomping on individual liberty. It's about saying we've got an emergency situation. We need collective action, and we need to help people who, in many cases, lack the agency, lack the understanding, lack the ability to go and do it themselves.
Colin, the one difficulty I have with your line of reasoning is it sounds exactly like the classic socialist line of reasoning. Whenever a socialist experiment fails, it's because they didn't do it the right way. They needed to do it my way. And what you're talking about here is you're pointing fingers. You say the governments have done a terrible job. You say the World Health Organization has done a terrible job. If only they listened to my version of the collectivist creed. And what we've learned here, and just the very hard way, with unbelievably, I would like to get into the collateral damage story. What we've learned the hard way is that every single time this collectivist decision gets made, it has these adverse, unforeseen consequences. People are monkeying around with a system that is way more complex than they can comprehend. They do not understand the first thing about the collateral damage that each of their absurd collectivist policies are going to entail. They don't see it coming. When it happens, they can't believe it. They do nothing to reverse them. And so we have an epidemic of collectivism that is causing an epidemic of death and poverty.
I'm going to put that to the test and actually ask you both, starting Colin with you. How do you diagnose, how do you assess the damages? Because obviously with COVID, we've got COVID deaths and illnesses, but you also have preventable cancer illness and death, which some say eclipse the number of COVID deaths, even though that'll be measured out into the future. You have suicides, you have addictions, you have people's dreams being crushed with closed businesses and unemployment. How do you take inventory of this and translate that into a cohesive policy?
Well, it's a great question. And I think my answer is that's such a complex question to try and answer. We're only going to get to an answer years after the fact. It's going to take a lot of analysis. And I recognize that's actually not a helpful answer. I suspect that we may find that the damage inflicted by lockdowns, which I think is very much what Nick is arguing, exceeds that inflicted by COVID. That may well be. It's plausible. We won't know for a long time. And how we measure that, I haven't even begun thinking about that. It's complicated. But mask wearing never killed anyone. So some kinds of collective actions do work. And Nick suggested that I'm in epistemologically problematic territory because I've said, well, people have done it the wrong way and there is a right way. Well, that happens to be, I believe that just happens to be the case. We could be doing measures that don't cause this kind of damage. Absolutely. And for the small number of businesses we need to close. For example, I believe that one of the only things we need to really deal with is make restaurants into takeout situations. So we need to cover rent. We need to subsidize lost income if there is any. And we should be able to do that. And we should be able to prevent the suicides, the domestic violence, right? That's right there. Is an enormous problem. We should have health systems that aren't overwhelmed. So you're right, all the cancer surgeries are able to happen. We should be targeted in our collective approach because I think the question you've asked is absolutely central. Lockdowns cause a lot of damage. I think Nick and I agree.
Nick.
Yeah, so your question is what policy should look like?
Actually, the heart of the question is, how do you assess the damage even before you start
Yeah,
translating into a policy? And it sounds
yeah.
like you confess,
Okay.
Colin, that it's
Oh,
just darn hard and it's going to take years to do that.
no,
And
I can give you, I can give you some pretty easy ways to assess it right now. We don't have to wait for years. Okay. We will have a million infant deaths, child deaths, infant deaths before the year is out around the world. We will have, in South Africa alone, an increase in childhood diarrhea deaths that exceeds the total deaths for coronavirus in our country. We have all but abandoned our tuberculosis treatments, our HIV antiretroviral programs. Each one of those causes will dramatically exceed coronavirus. And I haven't even begun to talk about the Preston curve, the effect of decreased incomes on mortality. We expect that broad sweeping story to be 100 times worse than coronavirus. And you could probably argue that on a global level. So I think that we are already seeing the emergence of these things. It's not going to take long at all. When you're talking about 100 times the scale of carnage, it'll be apparent within a few months.
Tuberculosis takes a lifetime. Tuberculosis takes a lifetime to measure. So I don't think we can be so easy on that. And I think what you're suggesting is that public health infrastructure where you are is inadequate, and that more collective action is needed. There ought to be more public health infrastructure. We should not be pulling back on HIV. We should not be pulling back on healthy babies. We shouldn't be doing any of that at all. One of the highest rates of infant mortality in the world is actually the United States, because they don't have collective action. They don't have a public health care system. So I think we could improve that, absolutely. Now we didn't, and now we're in the situation we are. So fair enough. But I don't think that's an argument to pull back and to say more individual liberty, less collective action.
We don't have a public health system because the government has been pursuing socialist policies for 20 years and has
that doesn't make sense.
Negative per capita economic growth.
That doesn't make sense. Let's stop using the word socialist, because we both use that differently. A government that's oriented to the collective is automatically going to orient to public health. If your government isn't spending on healthcare and public health, it's not orienting to the collective.
A government that orients to collective is also going to orient towards centralist policies and approaches. Those two go hand in hand. And when you do that, you prevent knowledge generation and economic growth. I mean, that's one of the oldest stories of economics.
But you'd have public health nurses taking care of tuberculosis.
Sorry?
But you would have public health nurses actually on staff taking care of tuberculosis. Knowledge generation is only one piece of it. You're saying that it's not effective delivery.
Get the resources. I mean, you've got to have a growing, vibrant economy with knowledge generation in order to create wealth, in order to have public health. If you start in the socialist collectivist mindset and, at some point where you're all abundantly wealthy and happy to stay that way and not have any more growth and any more improvement in the standard of living, then fine. But that's not the case for 7 billion people on this planet.
What about Scandinavia? We've already been through that. They've got fantastic public health. They've got amazing healthcare systems. They've got a lot of knowledge generation. They actually do really well. There is a balance, no question. I'm not suggesting the extreme where no one has any individual capacity to do anything. I'm saying there's got to be a middle ground here. A public health system that works would be one of those pillars. And to say that we have to favor individual liberty now because we never bothered to build a public health system, I think is really quite self-defeating. I go right back to Scandinavia. They figured out how to do it right. Why can't the rest of us?
Okay, so here's what I think the policy ought to have been, and it doesn't involve much that's collective, okay? We ought to have recognized upfront, what I've emphasized several times during this hour, that the mortality in this disease is profoundly, profoundly age graduated. It has, in fact, syndemic characteristics, okay? So the first thing that we ought to have done was recognize straight away that the group of people that needed protection was actually quite small. This is not a disease that kills or that has anything but negligible risk for the vast majority of any population, especially the younger populations of the developing world. I mean, we've had, there's country after country, from Mongolia to Tanzania to Zimbabwe, where there was nothing done by government and where they've had zero mortality. And that's not because they weren't testing. There were plenty of people in white coats and Range Rovers running around shoving sticks into people's mouths. Okay, to reach the conclusion that we needed to protect the vulnerable was not difficult. Okay. And that's the fundamental notion behind the Great Barrington Declaration, which our advisory board members are the signatories of. And that, I think, is what the policy ought to have been: a focus on protecting the vulnerable. I do not have a lot of truck with the theory around asymptomatic transmission and the need to shut everybody down. Whether it's true or not, I think that the way to achieve the maximum protection of the vulnerable would have been to let the rest of the population get on with their normal lives. I stop short of suggesting that they should have had corona parties, because I don't like to advise people to go and get infected by a disease, even if it has low risk for them. But they should have gone about their normal lives. That was the best way to protect Granny.
So let me respond to that, because it's a very, very important point. This idea of the iron ring around vulnerable populations. It's a great idea. I know a few public health physicians who favor it. The problem is there aren't any instances of success. Even in Sweden, look where the deaths happened. They happened among the old folks. I agree with very much what you said, except that first of all, you would need considerable collective action if you're going to actually protect a vulnerable group. You need to stop visitors from coming in. You need to enact a lot of rules, and it still doesn't work. So you're arguing for collective action, and you're arguing for a policy that we know doesn't work, because we keep trying it all over the place and it doesn't work. COVID is still killing a lot of old people. In the United States, there will be more deaths from COVID than there were in all of World War II. And that's going to happen in about the space of about a year. That's a lot of death. That's a lot.
I find those comparisons histrionic. I mean, you have how many, what, 100 times more cancer deaths every year, and I mean, we don't just equating a number of deaths to some or other event doesn't alter what the policy towards it should be.
Well, cancer is preventable. This is.
Sorry.
Cancer is not preventable in the same way that this is preventable. I think that's the difference.
When the average age of death amongst the coronavirus deaths is higher than the average age of death of the rest of the population, I think you have to moderate that statement.
I still think the iron ring idea, the idea that we can just protect vulnerable populations, it works really well on paper. So does Marxism, but neither one works.
It's not a binary thing. It's not an iron ring. You're talking about a direction. It can just be based on information. It doesn't need to be coercive.
It doesn't work either way. It doesn't work.
Let's pick on this charged word, Marxism. So we've gone into the socio-political realm a bit here, and maybe we can go a bit further. So in 1985, Robert Higgs, an economist, published a famous paper, and he wanted to understand why over the last 100 years the government had grown so much. And he pointed out three crucial observations. One was that in times of crisis, the government expanded. So think World War II, think the Great Depression. Second observation was that it wasn't just taxing and spending more, it was fundamentally expanding the scope and authority of the types of decisions it was making. Observation 3 was that these changes were accompanied by a prevailing orthodoxy or prevailing thought that was fundamentally morphing in society. People's philosophies were changing. And he called this the Ratchet effect, because even though it was the crisis that led to the growth, it never receded to its pre-crisis level. It always remained larger and significantly larger. And this residue continued to accrete over time, the Ratchet effect. Do either of you, as long as you're bringing up Marxism and proportions matter, do either of you have concerns that this Ratchet effect is going to lead to too much growth of the government?
I'll go at it first. I think that's a very, very interesting pattern, but it's confounded with the growth and globalization. There's a whole other layer of government action and activity, and that's on the global stage. I'm not a fan of globalization, but I'm also not an economist, so I don't want to overreach. I don't want to overreach what I know. I don't think governments need to get bigger. I don't think they need to get bigger because of COVID. I think they need to be smarter. And if governments can be smarter and smaller, I'm okay with that. It's a very, very interesting observation. It's actually disquieting to think about that way. So I'd hang some of it on globalization and say that that's moving through time as well. And that's post World War II. But I don't think when I say, under emergencies that we need a different set of rules and so on and so forth, I don't mean we need to hire. And I don't even think we need to have more control than the tools we already have. It's just a question of an alternate way of operating with the same resources, maybe with less. It's just simply a different set of rules. So I don't favor government growth. That doesn't strike me as good inherently.
Mm-hmm.
Yeah, so I have a take on this problem. It's very close to my heart, Josh. My view is that what's really missed out by a lot of people is the scale variance that you get with respect to problems of this nature. So it's interesting to me that the focus has been on these tiny countries, Denmark and Sweden. I think these ideas of local and local collectivism evaporate very quickly as you increase scale. I don't think if you try to model the whole of the United States or the whole of the United Kingdom on a Danish model that you'd get very far. It would become a congealed mess very quickly. So I think understanding that how complexity and the emergent properties of scale work against attempts to centralize decision-making in an effective way and to take collective action is a very important intellectual step to make. So I would suggest that the solution to the problem that gives Colin some of his collective ideas and me some of my human agency would be to work out systems of governments that devolve power. And there's a long history of this kind of idea working, the Catholic concept of subsidiarity, where you must devolve a decision to the lowest possible unit, is one that I think is supportive of working in this direction. So I believe that people have an innate and social regard for each other that tends to come out in pro-social collective type actions, voluntary actions, when they are permitted the agency to actually negotiate those themselves, as opposed to simply parting with their money to some great central superpower who then disperses it according to their political whims, maybe in favor of an electorate far flung from them. And I think it's no accident here that the great tragedies that we're talking about are taking place at the levels of the supranationals, the derisory role that the World Health Organization has played, the failing of the very large countries to produce coherent responses that we can get behind and try and emulate. I think these are very important points. But to me, again, we probably end up in a semantic debate. To me, that collectivism only gets beautiful when it happens on a very local scale. And when it gets big, it gets very ugly very fast.
You know what? I actually have to say I agree with almost everything you've just said. The thing I say when I talk to the media more often than anything else is that public health works best when it's conceived and implemented at a local level, simply because circumstances vary and they're different. Right. Canada has a distributed public health system, healthcare system. Each province has its own. So does Germany. Both countries have had some successes and some failures. Where they've had successes, it's because what the famous urban planner Jane Jacobs said, you'd like this, Nick. She said, all governments make mistakes. Big governments make big mistakes, and I think she's absolutely bang on. So you can have that decentralization and collective action at the same time in an ideal world, and this is where Canada has not done well. In an ideal world, those different jurisdictions actually pay attention to what each other are doing, make use of the diversity of approaches, select those that seem to make sense. I don't like to use the term best practices because that suggests that it's devoid of context. But to say, look, they've tried X, that seems to be working for them, might that work for us? That is a better way to go, absolutely. I think centralization, I think we seem to agree on that. Centralization does not scale well. I'm with you absolutely. And I know a bit about complex adaptive systems. I think we're talking about very, very much the same thing. So no, we're absolutely fine. But I think you can have that collective action still at a local level. It's the individual liberty, it's the every man for himself model that I think where we run into trouble.
Yeah. And so what happens is when you go down to the local level, the collective action can be voluntary.
So let's get into that, because that seems like it really is at the essence of this. And Colin, I'm curious how much faith you have in the markets, in voluntarism, and people harmoniously or voluntarily choosing their interactions to affect significant outcomes. Time zones exist because railroads chose to coordinate activity. something as lofty and big as that, right? And even grand things like our vocabulary, they evolve in bits and pieces, not through some central planner. So certainly the voluntary approach has yielded some massive and productive phenomena. I'd love to hear a bit on your thoughts about how effective could voluntary interaction be, and where do you see the fundamental limits to that?
So a lot of people, not everyone, a lot of people are fundamentally selfish and will work for themselves rather than for the collective when given the chance to do that. I'm not going to say that's either good or bad. I think that's just my observation. There's a logical game called the tragedy of the commons, right? So if you can imagine, let's say 100 people each have 100 sheep grazing on the common green. That's open to everybody, and that's how many sheep the green can support. And then one person decides to add 101st sheep, right? They do that, and they get 100% of the benefit of that extra sheep, but only 1/100th of the suffering of the fact that it's now being degraded. And so that's the problem, is that everyone motivated by self-interest will essentially reap 100% of the benefit. So if I flout the rules, I get 100% of the benefit, but I share in the risk among absolutely everybody. So economically, in terms of our choice, the wisdom of our choice, there needs to be something there to make people go, wait a minute, this is really bad for everybody. Even though I'm getting 100% of the benefit and only a tiny fraction of the risk, I still shouldn't do it. That wisdom, and I'll call it wisdom, I think is in short supply. So I'm not very optimistic about human nature. Is it possible? Yeah, but the problem is there's too many people who want to have that extra sheep on there because they know they're going to get 100% of the benefit. And let's face it, we've got a very polarized world. There's a lot of rich people and a lot of really poor people. So clearly there's the rules of the game are not treating people fairly, not treating people evenly. And some people get that giant amount of money or have very little of it as a consequence of the kind of wisdom that they apply or the kinds of self-interested actions that they take. Again, I'm not going to judge it. I don't think I have the standing to judge humanity, but that's my observation.
Mm-hmm. Nick,
Maybe
sounds like you may have a little more faith in voluntary interaction. What say you?
Sure. Well, I'll give you an example from the current epidemic that I think should restore your optimism. So as I've said, we've had a government that has become increasingly centralized, increasingly socialist in its policy responses. It's faced as a logical consequence, reduced capacity to do anything. Along comes coronavirus and they rub their hands together and go and get full tilt socialist on the country's proverbial. And we have a disaster on our hands, immediate problem of people not having sufficient nutrition. So what happens when the state capacity completely evaporates and there are people around the corner from you who are about to starve? We have this phenomenon called community action networks. And these just spontaneously form in predominantly middle class and upper class environments. And they started producing networks that could deliver food. You know what the government does? Government says to them, no, that's not allowed. You can't distribute food. We do all the distribution of food. You're most welcome to drop off the food at the government depot and we will make sure it gets there. Of course, To which the community action networks raised a middle finger and went about distributing their food. And thank goodness, because all that would have happened with that food going to government is that it would have been stolen along with all our PPE money. So, these things do happen spontaneously in times of crisis. And I think for me, it was one of the most uplifting things to see in amongst all the tragedy of this completely misbegotten policy. So I do feel warranted, uplifted by having seen these moments of genuine collective action, to use your words. But I do remind everybody that was happening at a very local level. That was the citizens of my neighborhood or one next door helping out the nearest poor township. And that's how the game, I believe, should be played. That's where you get the best results, because people then actually viscerally partake in their shared humanity rather than having it dealt for them by some higher power in a fancy office in a government building.
That makes sense, but there's a key thing there. You talked about the fact that they're middle upper class, they're educated. That makes sense. That makes absolutely sense. But that only describes a minority of the world's population. I'm told that there's an area of pollution the size of Texas in the Pacific Ocean. Pollution is a perfect example of how 7 billion people, the majority of them, don't have that enlightened view. And every time you dump something in the ocean, you get 100% of the benefit of getting rid of your trash and only 1/7 billionth of the consequences of it. So I see the tragedy of the commons playing itself out across the whole population. I love that story, Nick. That is uplifting. Absolutely it is. And I can point to some stories here too. And I would say the same thing. They're local. They're local and they're among people who've had the education and also who have the means, right? They have the agency essentially to be able to think that way. I wish we had more of them where you are and where I am. The problem is we don't.
So on the one hand, there's a question as to whether someone will step in to take action in the absence of some central planner, right? Then there's also how effective they'll be. So we have, let's say, the greatest offender when it comes to pollution, maybe China. I'm not sure, but they certainly have someone involved with central planning. So there's something going on there. In an ideal world, Colin, you mentioned things would be different. In the real world, we've got that central planning mechanism, but it's not working. So if we look at trade-offs, what gives you faith that that central planning mechanism is more effective?
So I'm not sure I believe that central planning is effective. I think perhaps sometimes it could be, but actually I do tend to share Nick's view. The more you centralize, the more inefficient things get, and history is littered with that. I mean, the USSR had nothing but chronic shortages all the time, and then it seems to be pretty obvious. China's more complicated, and I'm not an expert on China. They do have all kinds of local government, and actually the big problem with COVID being covered up, that was actually covered up at a local level. That was covered up at a very, very local level. They had a surveillance system in place, and it was undone by machinations at a local level, which I think were primarily cultural. I mean, there's someone there who said, we don't want trouble, and that's going to be our guiding thing. So I think you can have mishap centrally with central systems. You can have mishap with distributed systems. But I tend to agree with Nick. You're going to see more mishap when things are centrally managed.
So we may already have really gotten to the nub of this, but in case we didn't, let me probe a little bit further. On the one hand, we've had lots of statistics, lots of facts and figures each of you have put forth, right? But when it comes to values, collective action versus individual freedom, these are values choices, right? And with values, we're not usually asking someone to give us the statistics before we choose which value we prize over another. So if you value freedom, Nick, for example, you're not asking someone, hey, tell me what freedom of the press looks like. How much more accurate will the stories be? Or freedom of speech. How much more productive will conversations be? Or freedom of religion. Can you quantify how much more harmonious society will be if we have right? You value freedom. And so I'd love to understand what really animates you at the heart of this. Why do you cherish? Why are individual liberties sacrosanct? And Nick, to the extent you two disagree, why is the collective essentially more important? Nick, why don't we start with you?
So I think the word I've been trying to get people to use, or at least I've been introducing them to it, is thumos. It's a seldom used word these days, but beautiful. Comes out of the old Greek literature. It's a word that can be loosely translated as spiritedness. And I think spiritedness and the energy of curiosity only exists under conditions of freedom and under conditions of local agency. This is true of all evolutionary systems. The systems only evolve if you allow there to be a proliferation of generativity and curiosity and the true deployment of intelligence only takes place under those conditions. And I think they get stifled very quickly the moment a monarch or a large central government steps in. And for most of history, human beings have lived in conditions where such generativity was simply not possible, where people were born and died living lifestyles that were broadly the same as their parents or grandparents experienced. And it's only been since we embraced the notion of individual value, of individual liberty, that such generativity has come about. But if I can put another spin on it, if I may, one of the very alarming things for me in this whole story has been the rise of the utilitarian calculus. Everybody is trying to make an argument framed in terms of lives lost and lives gained. And I've often felt personally the need to reach for the concept of virtues or values. I think if you go to again, back to the old seminal works of the classics and of Christianity, you find a set of values that we have not been approaching. The importance of wisdom, of temperance, of courage. There's been a lack of courage at play here. And I blame it on this inveterate safety culture. The over-response here, the need to try and, there's a deadly virus and we're all going to die. We have to run away and hide. We have to hide behind masks. We have to hide in our houses. And you can hear now I'm getting spiritual on this thing, not going the direction of numbers. I think that's the problem. That this is the weakness that we've been seeing. And what we needed more of was some thumos, some courage that would have kept clear heads. We wouldn't have panicked. The panic here has been deadly. The fear has been deadly. There was a shortage of courage.
Mm-hmm. Colin, what say you?
Every religion, and you mentioned Christianity, every religion's got those kinds of virtues, and they've also got a lot of the other, right? Which is repression, which is domination, right? I mean, if you want central planning, look no further than the Church of Rome. I think I'd like to keep religion out of it entirely. We want to differentiate between peacetime, what is ideal, what is normal, what is good, and emergencies. And there's no such thing as a good emergency. Right? So there are such things as emergencies. Sometimes they come as war, sometimes they come as pestilence. And I think we need an enlightened society has a set of rules that it can invoke during emergencies and then put right back in the cupboard again. Now, I hear you loud and clear that maybe governments tend to misuse, and I heard Nick say that, and I don't know much about South Africa, but I'm prepared to believe him. I've seen some abuse here too, to be honest, of emergency powers, of course. What power corrupts? Aldous Huxley, power corrupts, and absolute power corrupts, absolutely. So I believe that. So I think a smart society actually does allow this kind of liberty, but it has a rule book. It has a playbook for emergencies that does allow for some collective action, and it protects people who don't have the agency. We've talked about people who are Christian. We've talked about people who are upper middle class, who are educated. COVID is a racist problem because it affects, in Ontario, it affects the racialized minorities. Canada likes to talk about how we're such a fair, wonderful place. Well, we're not. We've got a lot of oppression. We've got a lot of racism. We just don't like to talk about it. But 4 out of 5 people who get COVID have brown skin in Toronto. That's fundamentally wrong. And it's because they are poor. They don't have the education. They don't have the wisdom networks. They don't have any of that stuff. And to simply say, well, all right, I guess let's be every man for himself. Let's be individual liberty. You're actually not consigning equal odds. You're not consigning an equal situation to everybody at all. So I do like the idea of those among us who are more educated and more wealthy to help those who aren't. My problem is that I think they kind of need a shove, or at least some augmentation with government, with policy, when there's an emergency. And I'm a big fan of keeping that very bounded, very constrained. The Patriot Act that I mentioned at the outset was an incredible incursion. I mean, it's actually fully unconstitutional if you look at the United States and its strictures around privacy and government, right? No unlawful or unreasonable search and seizure. Anything stored on a file server anywhere in the United States could be looked at by the government. How is that reasonable? So they violated their own constitution, but they did it in a way that had a sunset clause. I think they may have overreached at the time anyway, but they were afraid. They didn't know. Same thing with COVID in March and April. And Nick goes back to March and April and things that happened there. We didn't know. Now, MERS, which is a close cousin of COVID, now that's got a 60% mortality rate. It's very similar. It's a really similar cousin, and COVID may yet mutate and get worse. I don't want to be alarmist, and there's no indication that's happening, and I don't think it will, but it could. This is the way biology works. This is the way infectious disease works. So to simply say we should have courage and everyone should get sick who can afford to get sick kind of ignores a lot of contingency. And that's why I think having emergency structures for collective action when we need it is really important.
Question, Nick, before you respond, very powerful example you just put forth, Colin. And I'm reminded of a quote. This is a quote by Thomas Sowell. He said, "The welfare state did to blacks what slavery could never have dreamt of doing in its wildest imagination. But people perhaps put forth a similar argument that without the welfare state, well, minorities would have been trampled upon, but yet there were those unintended consequences. Nick, what are your thoughts on Colin's point?
Well, actually, I do think that there's quite a lot that's relevant about race and the COVID response. I don't find it at all surprising that we've had, particularly in the extreme latitudes, very bad mortality rates amongst dark-skinned people. And I think the elephant in the room there is vitamin D. And the reason vitamin D has not been given air is because it doesn't make any money for Big Pharma. Again, it's a centralization problem. You literally suppress the research. And the emergent research that is breaking through suggests that this is one of the main causal factors. And the worst thing you can do is lock people in their houses out of the sun, and while there's a viral epidemic going on. You needed to do exactly the opposite. They needed health and sunshine. And so I think that's a big part of that debate right there. That's just waiting to, when that story is told, there's going to be a lot of egg on a lot of faces. I would not rush to a central government to resolve that kind of problem.
So I was going to say, I think that's actually a very, very interesting proposition. The people I'm talking about don't know about vitamin D and can't afford it. They can go to the drugstore and get it. It's a knowledge problem and it's a money problem. I don't see suppression of research. If that's going on, I don't know. But my point is, I think some good collective action would be great to supply vitamin D for free to people who can't pay for it. So that's a great example of collective action, not suppression, not police state, but simply getting together as a government and saying, let's help people who need help. That doesn't seem like a...
Okay, but can you agree, though, that what we've faced in this epidemic has been a complete overshoot of, have we lost Colin? A complete overshoot of centralization and of coercion and of inhibition of speech, and that it's had disastrous outcomes. And can we acknowledge that there's a major control problem when you scale things up and start trying to deal with things at the level of the world and an epidemic? And that local solutions might perhaps have done a better job. Can we agree on that?
Before you weigh in on that, Colin, so as a non-scientific, non-medical person, I was told I get enough vitamin D by getting outside for 15 minutes a day. Colin, thoughts?
It's complicated. I think, in the extreme latitudes, summertime is very different than wintertime in terms of daylight and so on and so forth. It's hard for me to imagine that our brief lockdown period in March would have done that. I think vitamin D is a sort of a longer term thing in terms of building your immune system and a healthy body. So perhaps people who had not had vitamin D over the course of the winter, in other words, they weren't buying it in the stores because they certainly weren't getting it from the sun, were in a worse shape come March. That's possible. That would actually be a pretty hard thing to study, and I hope it does get studied. I don't know about suppression of research there. I can't imagine why. Universities here on this side of the pond are completely independent. You get a grant, you study it. I don't see government control over the research agenda in Canada, and I certainly don't see it in the United States. Universities are really independent. That's why I like working at one. I live in a tiny house with a big mortgage, so I don't get everything in life, but I do get that freedom, and so do my colleagues. So I'm not sure about that suppression. I think that sounds like great research to do.
I'm glad to hear it.
Mandated vaccines, should those be in place or shouldn't they? Nick?
I would say absolutely not. My children have been vaccinated. Why do I have to say that? Because the moment I express any reservations about mandated vaccines, somebody comes out and calls me an anti-vaxxer. Okay, again, this ridiculous labeling and censorious approach, But so my view is that you've got to be very careful with a new class of vaccines as these are. The study and safety aspects are immense. There have been some catastrophic rollouts of new types of vaccine. This thing has to be watched very carefully. There are immense corporate interests at work. They are lobbying governments senseless. And under that situation, we've got to all be very, very careful. And governments mandating improperly tested vaccines and at the same time exempting those vaccine companies from liability is, in my mind, a recipe for absolute disaster. And we've got to remember that we need to understand what a vaccine's doing. A vaccine is a blunt instrument. You're taking a crowbar to the Swiss watch of the immune system. The way the immune system works is one of the extremely interesting and most complicated things in the universe, probably, second only to the human brain in terms of its complexity. And so when you take one of these instruments to the immune system, you must understand that you are taking the crowbar to the Swiss watch and you are hitting that thing. And it has an effect, okay? It may solve a problem, but it may also do damage. It may do long-term damage. We do not know. And when a vaccine trial like these have been done predominantly on healthy people, focusing on the question of whether they develop mild symptoms or not, I get quite worried. I do not see the tests for whether infectiousness is reduced or whether transmission is reduced. I do not see the tests for whether death is reduced because they're not testing enough of the vulnerable people. Why aren't they? Because their doctors won't let them. They're needing to do the tests in countries where rights are not respected. So we've got a whole lot of vaccine programs being run in Brazil and South Africa because nobody would allow them to be run in Canada or the US. So
well, that's not entirely true. You need to test vaccines where you want to use them to be ideal, but I agree with almost everything you said for slightly different reasons. I think when you should never forcibly jab anybody. I think that's really crossing a line. Not that I signed up for this to talk in favor of individual liberty, but no, I think that you're really crossing a line for a couple of reasons. One is that the best way that you can actually rejuvenate the anti-vax lobby is to make them mandatory. So you actually get a horrible blowback effect. That's really important. Number two, the vaccine is going to be a scarce resource. If a bunch of people don't want it, great. That makes the lineup shorter for those who do. And you don't need to immunize the entire population in order to make COVID stop. So let it be voluntary. There's no problem there. No problem at all. I don't disagree with what you say, Nick, but I see it a little bit differently. I'm going to get the vaccine. I'm going to get it almost certainly, unless I see contraindications that I haven't seen. But I absolutely respect people who don't want to, and I see no problem. There's no downside to the collective if individuals say they don't want to do that. As long as if everyone who doesn't want COVID is allowed to get a vaccine, then anyone who wants COVID can have it, as far as I'm concerned.
Do you think the same thing when it comes to mask mandates, Colin?
That's different. You wear a mask so that you don't spray droplets on other people, right? So a mask is not self-protective. A mask protects others. Moreover, the objections or concerns that Nick has about vaccines obviously don't apply to masks. No one's died from wearing a mask. And in fact, there are some people with autism or other conditions where they just can't wear a mask. Okay, let them not. Again, I don't want individuals to suffer really horribly. If 90-something% of everyone is wearing masks, good enough.
Mm-hmm. Nick, what say you?
Yeah, on the mask front, I'm not as willing to sign off on there being no downsides. I think, one of the big problems that we all face here is that the level of fear is not proportional to the actual threat. And that fear, I think, has profound societal consequences. I don't know how you undo it. There are people my age who regard this as a deadly virus, and that is just profoundly wrong. So when I say to people, look, I'd actually rather just get COVID than have a vaccine, they look at me as if I'm crazy because I've studied the risks and I know what a person in my shape is going to, encounter on the risks are comparable. Take the vaccine, get COVID. It's the same order of magnitude risk. I'd rather get the disease and let nature's gift to me and my immune system protect me when I'm older. So that's my view. Similarly on masks, I would take the view that there are downsides, there are consequences. That one of the extremely bad things that masks do is they sustain the environment of fear. And I'm worried that this environment of fear is going to be a hard thing to correct now that it's been created by misinformation from these centralist organizations, these collectivist organizations who've run roughshod over our societies. So I would like to see the masks come off. And bear in mind, I say that as a person who believes that epidemiologically, the non-vulnerable should not be wearing masks. If you want to protect the vulnerable, you do not slow transmission in the non-vulnerable population.
So I have some objections to that. We don't know what the long-term effects of COVID are. We can't know. So you're talking about two unknown risks: long-term unknown risks to vaccines, long-term unknown risks to COVID. So they're both unknown. So you can't say that you've weighed them and you understand they're the same. That's actually not knowable. That's simply not knowable. Granted they both have risks. but you're also assuming there's a healthcare system available to take care of you if you end up being in the 20% or so of people who seem to require medical intervention. And if there isn't, if the hospitals are full, if you happen to catch COVID after a few thousand of your peers and neighbors, maybe you're out of luck. So I think it's easy to assume, and it's fun to assume the healthcare system will be available, but it won't. As for fear, that's not what I'm seeing here. I'm sorry if that's what you're experiencing on your end. I'm seeing actually a lack of fear. We still have cases rising quite a bit because people are having gatherings in their homes against advice. Now, I'm not interested in having the state walk into people's living rooms. Again, that's where there's a line to be drawn, but that's clearly going on. And I even know anecdotally among neighbors, I don't see fear. Actually, I see what people are calling COVID fatigue. I don't like that term, but essentially people attenuate fear. Human beings are very good at attenuating fear. It was terrifying in the beginning, and now it actually isn't. I see masks, people see masks here as a nuisance, and a nuisance never killed anyone.
Nick, what say you?
Can we come back? Okay, yeah, we can. Sorry, I thought you might want to move on. Yeah, no, I'm not convinced here. I find the science very uncompelling. I find it difficult to agree that there are no adverse consequences. Let's take a step back. Let's look at it from an evolutionary perspective. I go to evolution all the time. Okay, it's a useful construct. We have evolved the mask, the mucosal immune system in our cilia, in our throats. Okay, it's a terrific system that's been dealing with bacteria and viruses for hundreds of millions, if not billions of years. There are many masks in nature. Every cell membrane, to some extent, is a mask. You can scale all the way up to the baleen whales. They have filters in them. Nature did not provide us with a flap of cloth over the front of our mouths. So I'm very skeptical about the claims for the reduction in spread as a result of mask wearing. And when I furthermore do not see it in the high level data at the level of introduction of mask mandates, agreed, that's a different thing. But when I do not see the benefit in the data from mask mandates, my skepticism is enhanced. So I'm not sure that this is a great example of something that we should just accept willy-nilly as having no effect. When I see people masking children, when I see people masking babies, I draw the line. My heart breaks every time I drop my children off at school in their little masks. I do not think this is how children should be.
We don't mask babies. That actually doesn't make a lot of sense to me. Look, super spreader events in Canada all have one thing in common, and only one thing in common: no masks. And the data is incredibly compelling. I agree with you that we have our own internal masks, absolutely, but we also have tuberculosis. You pointed to that. They're not perfect. Moreover, in the winter, which is what we're dealing with right now, in the winter, that cold, dry air dries out all those membranes. They don't work nearly as well. Our bodies did not evolve. You want to talk about evolution? Africa is where we evolved. Africa would be a great place to be right now, right? But from the weather outside, I can say that with conviction. But I don't live in Africa. I live in a really cold place right now where the air is very dry and we're far more susceptible. And again, super spreader events all have one thing in common. People are sharing air and they're not wearing masks. Mask wearing seems to really interrupt it. And I didn't say that there were no negative effects, just no one died from it. It's a nuisance. It's just not awful. And if someone can't wear a mask, let them not wear a mask. I'm okay with that. But I'm not okay with making it optional, because in Canada, it's been polarizing. In states or provinces that are really right wing, you get a lot of people digging in their heels and saying, this is toxic masculinity. This makes me look afraid and I look stupid and I'm not going to do it. Well, you're putting people around you at risk. Rousseau, upon whom the French philosopher upon whom American democracy was founded, said, look, you can have absolute individual freedom with one boundary only. And that boundary is when you start to encroach on someone else's individual freedom. I think mask wearing crosses that line. If I get to spray droplets all over you because I don't feel like wearing a mask, I'm actually interfering with your with your freedom to be healthy. So I think masks are okay. It's not in the same category as vaccines at all.
Yeah, we're going to have to agree to differ. And Josh, I would tell you, we could talk about this thing for hours, because there are so many interesting things around the dynamics of droplets versus aerosols. And also, just simple things like whether droplets get nebulized by masks. These are all interesting things. I wouldn't go dogmatic on any of them, but the situation is far more complex. And it's not a surprise to me, though, that, in the one randomized control trial that's been done in the case of COVID, and the 11, I think, that were done in the case of influenza, none of them have come up with statistical benefits for, or statistical significance for masks. And I think it's going to have to, the thing will only be decided at the level of those, that kind of quality trial. I think our observational studies are going to fail us, and our lab-based experiments are going to fail us. So yeah, until some decent, large, well-powered, randomized control trial has been done, I think you've got to be prepared to argue the case in either way, and be a little bit reluctant to invoke the precautionary principle in enforcing it upon a population. And I think that's true. You said just now, we don't know what the long-term effects of coronavirus are going to be. That's true for almost everything that we encounter that is new in our lives. And I don't accept that as an argument for assuming that there will be something bad or unconventional about this one. It's such a close relative of SARS-1. Differs only at the level of an individuum. The taxonomic distinction is so low. I just, and even if it was less related, if it was something, more novel than it's been made out to be, I would be extremely reluctant to take a precautionary principle stance and start inhibiting rights, freedoms that could, and where those inhibitions have known harms.
So we're taking certain things as given in today's discussion. For example, the complexity of the mask mandate. However, if individual rights reign supreme, then we would have nothing but private property, and the proprietor would be the one that would determine whether there should be a mask mandate on their property. So, for example, I was on the phone earlier today, true story, with one of our client partners who has retail stores. One of the stores had a fight break out recently in the parking lot around masks. Well, these kinds of issues about whether there should be a mask mandate would be relegated to the dustbin because they'd be clear as night and day. You own the property, you decide the policy. Now, Colin, you mentioned that no one's ever died from wearing a mask, and it's your belief that they save lives. So you would craft a policy around wearing masks. But then there's this gray area where it becomes less clear. For example, if you have an elderly person or someone who's on their deathbed and they want to see their children or their grandchildren smile one last time, do you tell them that they have to wear a mask? They need to be deprived of this experience? How do you think about policy amid that kind of complexity?
Well, if Granny's dying, I don't think taking the mask off is a problem, right? So I think there's very, very individual circumstances where we, I think, just need to be a little bit flexible. Being dogmatic is rarely a good idea. As for public versus private land, some things can't be privatized and shouldn't be privatized. Government offices, for example, the House of Parliament, Passport Office, the courts. Let's not privatize those things, right? So we do need some rules for public land and public space. I'm not a fan of masks outdoors because there's no evidence to suggest, and just common sense. There's no common sense reason to wear a mask outside. Avoid getting up close to people, which is it's good advice. And again, people need that. That's an individual liberty thing right there. You can't wander around with police and a measuring tape. You actually just need to give people that information and hope they comply with it. But mask wearing has been shown in Canada to make a huge difference. The definitive field study was in Germany, where because they've got independent regions just like Canada, they had mask policies coming in at different times. And so they were able to actually look at the individual effect in each case, and it had a big effect. And again, I go back to super spreader events all have one thing in common: no masks. Masks matter, but let's not overreach. Let's not make people wear them in their house.
One quick question. Are there any controls for that where there were such events, but with masks?
No, the German study had an artificial control group. It is a massively underpowered study. I think there were 179 cases in the one region and 149 in the other. It was just monstrously underpowered. I would never regard that as a valid scientific study. And I mean, the experiments, this is the problem with engaging with this type of science, is that for every one of these examples, I can give you another one. The very countries that Colin was praising earlier, Finland, Denmark, Norway, not a mask in sight, and there's no tragedy. If there's an effect, it's a very small one, and not this elaborate one that Colin's talking about.
Well, now, hang on a second, though. I mean, we can point to a lot of variables that that cause COVID to spread or not spread. Mask isn't the variable, it's one variable. So you can go to a context that's actually protected in a lot of other ways, including low amounts of spread, including a rural population, and say, oh, this rural population isn't wearing masks and there's no COVID. That's confounding. That is just confounding other causal factors. I go right back to super spreading events. 100% of super spreading events in Canada, 100% involve people together without masks. 100%. So what does that tell you?
I don't think you can conclude anything about the mask, because the only randomized control trials, as I said, that I'm aware of, 1 in COVID and 11 in flu, all come up with the answer that they do nothing.
We're going to have to agree to disagree on that one. I mean, I'm a fan of observational research and field research and epidemiology with respect to control of infectious disease, because that tells you what's actually going on, not what should go on. And it's the evidence looks very compelling to me. So again, there's two things we have to agree to disagree on. It seems like the utility of masks and whether COVID spreads asymptomatically. Those are two things we're just not going to resolve in our conversation. It's remarkable to me, though, Nick, we agree on a lot of stuff apart from that.
Actually,
and I'll tell you what else we agree on is the way in which discussion should happen. It's been a good conversation from that in that regard. I have thoroughly enjoyed it.
Well, I agree, and I hope we can shake hands on that one day, because I'd love to visit South Africa if you're not here.
Yes.
I've very much enjoyed this conversation.
And that's with the lights out. You should have seen it before. You probably did. The background was quite breathtaking. I want to invite each of you to ask either of the other any questions, anything on your mind that you'd love to open and close the loop on here.
I think we've had such a thorough conversation. I feel kind of spent. I think I understand Nick's position. I sympathize with a lot of it. He's a smart guy. We disagree on a couple of things, and poking the things we disagree on or agree on, I don't think we'll squeeze any more juice out of that particular orange. So I'll leave it at that.
Mm-hmm. Nick?
Do you think, I'd like to ask you this question. Do you think that in your view of policy, views like mine should be suppressed or fed to the general public?
Nothing should be suppressed in an open society, no question. You're talking to a guy who works at a university. You can't, you must not. Absolutely. But we have to really worry about misinformation and disinformation. So we really need to allow discourse and dialogue. And that's tricky. That's actually really tricky, because a lot of people can end up engaging in a lot of really dangerous behavior by hearing only one side of it. So you do need a way to have an open dialogue. And part of that is an educated population. And that's where we all fail, right? Can't really point to a country that's got education right. And that's a shame, because one cost of having this open discourse, one cost of giving your views just as much airtime or more than mine, is that some people will run with it and misunderstand from you or from me, right? That can go either way. So I wish we all had a better educated population. That's the downside, but I will never vote for censorship, never.
So it sounds like we close on an agreement that a marketplace is the ultimate arbiter and forum for the dissemination of information. Nick, I'm sorry. What were you going to say?
I was going to ask, what advice would you give me? Here I sit in this country. I've got my experts who have ordained certain rules. The scientists who are putting children in masks, making people wear masks outside, both things that you've disagreed with, that are doing any number of things that I have no doubt you would disagree with. Yet we are when we point these things out, we are the ones who are reported to the fact checkers and have our videos taken down by Facebook. I mean, to this extent, we wanted to do a schools presentation, which we did. It's very popular. You can still see it on the internet, but removed from Facebook. Why? Because the slide where we were simply reporting the World Health Organization's perspective on masks in children, which is that they're against them, was deemed unsafe. How did they put it? It makes the users of Facebook feel unsafe. Really, how is a group like ours, a group of private scientists, and we are that. I'm not a scientist. I just happen to be the talking head, but a group of private scientists trying to point out the lunacy of these centralist ways in our own country. What do we do? How do we break this when an American company is taking our videos down?
So you know what? What I know about South Africa would fit into a small paper bag. So it's hard for me to provide specific advice. The general advice I would say is you need to either work for a university or work with people who do, because that's what universities are absolutely there for. That's what they're protected for. That's why we have tenure. That's why we have that. We have this really expensive infrastructure because someone's got to stand up to government. Someone's got to stand up to the status quo. I'm a big believer in that. Universities are havens for dissent. That's what a former president of the University of Toronto once said. And it's really stuck with me because that, to me, that absolutely defines it. Now, if you don't have free universities, you've got a bigger problem. But I'm hoping you do, because you said private scientists. That private scientists, that's going to raise red flags here too. The media call me all the time. I've done more than 900 interviews in Canada on COVID since January. More than 900. Why? Because I don't work for a corporation, because I work for a university. So I'm seeing who should be listened to.
Let me clarify that. Our scientists are predominantly university scientists who are covert members. They're covert members because there is so much antipathy to their skeptical views at their own universities. So I don't know. I would disagree with you that the universities, I think they once performed that function. I think right now what they're doing is acting as amplifiers of a specific narrative, and that narrative is harmful.
Well, sorry,
Colin, how can you divorce universities if they're public? If the universities are public funded, how can you divorce the perspective of the employees, the professors, from the government that funds them?
Whether a university is publicly funded or privately funded, there's interest at stake. When someone's paying the bills, someone's paying the bills, right? So I don't think that question is about public versus privately funded. It's a governance question. It's a governance question which really reflects the society in which it's based. Do I feel efforts to censor me in the classroom? Actually, yeah, political correctness, absolutely, right? So there's certain things that I'll get into trouble if I say or don't say, but those are around how people are treated. Those are not actually around basic ideas about things like COVID. So I actually feel very distressed by what Nick has to say. And again, what I know about his neck of the world and a lot of other places, I guess would fill books. So I just don't have an easy answer. Maybe my answer is that I feel very lucky here.
Yeah, I should possibly have mentioned that we're an international organization. The majority of our members are from other countries. We cover about 25 countries. So what I'm reporting here is quite general, I'm afraid. So we have members in the United States, members in Canada, members in Hungary, members in Brazil, Dubai, and it's a fairly consistent theme. People who come into the organization and have to do so quietly. It's alarming to me. But I tell you what, I don't think they're being paranoid. I think that's real, and the reason I say that is I've experienced some of it myself. Now, I happen to be a person of independent means. So I'm uncancelable. Nobody can cancel me. But I have had people try. I really have. When we first came out saying, look out, there's a problem here. Lockdowns have negative consequences and they may be bigger than the disease. We were absolutely pilloried. I don't know how many names I was called. Every card in the world got played in my direction. And we've carried on for 6-7 months because, as I say, can't cancel me. But if you're a university person and that's your income and the university turns on you, one of our guys actually, he tipped his identity. And so he was fingered, and within weeks had to leave. There was just too much pressure on him from his institutional.
But I've seen fat colleagues take very unpopular positions on things and they can't be fired and they're not fired. It just sort of gets down to whether you want to put up with that kind of abuse. Look, when you talk about having to move in secret and so on and so forth, you may just have a brand problem. You may need a PR company. You may need a different name and a different way to come at it. You may have managed to get yourself pegged pegged or classified as a gruesome organization. And then people are no longer hearing what you guys are saying. It could just be that. You just may need to rebrand it. I don't mean to be flippant about it or facile about it. But that's, that brand matters. And you may have poked a few people in the eye a bit too hard, a bit too quickly, and then the blowback happens. I don't know. This is outside. I'm not a PR guy. Let's just say.
Thanks for the advice.
So, this was a fantastic exchange of ideas. Colin, a few times we heard you say in different ways, in an ideal world, things would be a certain way. And it's fair to say we don't live in that ideal world. In your ideal world, Colin, it sounds like there would be better governance. And Nick, it sounds like you would say he who governs least governs best. You two demonstrated extraordinary civility and I think really elevated the discourse here. I think apart from learning about COVID, people can learn how our differences can bring us closer together and not divide us. So I thank you tremendously for that. And once again, for your courage and your time today.
Well, thank you.
No, anytime, Josh, anytime, Colin. I loved it. And I hope that your listeners did too. It's been a real pleasure. Thank you.